Hello everyone, I am Dr. Avinash Chaitanya, Head and Neck Surgical Oncologist at Care Hospitals, Hyderabad. Today I am going to talk to you about benign and malignant lesions of oral cavity and how to differentiate them. So, usually oral cavity has a lining called the mucosa, which is pink in color. So, because of any habits like tobacco or chronic infections or chronic dental trauma, there will be some changes in the mucosa that you can see. It may not look pink, it may not look red, but it may look white in color, and it may also not be scraped off. So in case you have any lesion in the buccal mucosa, that is the cheek, or on the tongue, which is white in color and it cannot be removed how much ever you rub it, it is generally called leukoplakia. So that is a pre-malignant lesion, and it may in the period of time turn into malignancy. There is a very low chance, but we have to keep it under observation. And if you have any habits, at that point when you notice a leukoplakic lesion, it is better to stop all habits. Next, you can find some red specks interspersed between or around the white specks, which is called erythroleukoplakia, and if the redness is more than the whiteness, it is called just erythroplakia. These are also pre-malignant lesions, and they are more likely to be converting to malignancy rather than leukoplakia alone. So these are some of the lesions which we generally see in the oral cavity, which are as of now benign but have a tendency to turn malignant. Sometimes there are some round lesions because of repeated dental bite, and they are called granulomas. So when there is a chronic lesion in the buccal mucosa or on the tongue because of a sharp tooth, there is a high chance that it may turn malignant, and it is better if you get it removed before it gets worse. And also grinding of the teeth or removal of the teeth, that is the extraction, can actually help you to avoid getting a cancer. And of course, when you are actually looking at a cancer, you will know because it is painful to touch most of the times unless the nerves are involved. So painful, bleeding, and also that there is a loosening of the adjacent teeth, or there is a area around the ulcer which is actually harder than the ulcer itself, will actually tell you that it's a malignant lesion. And also if you are having nodes in the neck corresponding to the drainage area of the primary site, it is for sure that you are having a malignancy, and that too in a higher stage. So it is better to consult an oncologist whenever you see that your mucosa of the oral cavity is not pink and turning into any other color. Thank you so much.